Hello, and welcome to the second video in our series about hidden spinal ligament injuries. This is a must-see video for anyone who has suffered neck, back, and other injuries due to a car collision in Idaho. Transform your understanding of car crash injuries and start your journey toward recovery and wellness with Dr. Todd Pickman's expert insights. Your body will thank you for it.
Now I will reveal to you these hidden spinal ligament injuries that are routinely missed across the board. And don't worry, following this part of the dirty little secret, I'll be sure to address the other components as well in the concluding video. The majority of healthcare providers and specialists alike are falsely led to believe that MRI is the highest level of diagnostic superiority in the imaging food chain. This is simply not true. So first off, what happens when you're involved in a trauma and injured? Let's say in the case of a car crash. Did you see it coming? We know it makes a difference whether you were braced for the impact. Was your head turned one way or the other at the time of the crash? These risk factors definitely do matter, but what matters most is not the mechanism of injury, also known as the force delivery system, but rather the injury or the derangement that is left behind. So what does that mean? Every injury leaves a biomarker, evidence that is consistent with the type of injury involved. So an injury such as hot grease splashing on the skin will leave a burn, a gunshot will leave a bullet wound, a dog bite will leave bite marks, and a motor vehicle crash will oftentimes leave a measurable injury identified as an imaging biomarker that many in the healthcare and legal arena are blatantly missing. This costs you, the patient, a misdiagnosis, oftentimes resulting in ineffective treatment, leaving your true injury unaddressed and unresolved. Let's dive into some anatomy and biomechanics to further investigate this point. Okay, so into the anatomy of a functional spinal unit. A spinal unit consists of two adjacent vertebrae in the spine and all the ligaments and connective tissue adjoining these two segments. With trauma, a vertebra can shift abruptly, damaging the ligaments that hold them together. The most talked about ligament in the spine is the intervertebral disc, and while the disc is a very important structure, it is not the only important structure. As a matter of fact, it is only one of 10 ligaments that connect two adjacent vertebrae. When you're involved in a trauma, the disc may be injured, and that can be serious and very important to properly diagnose and treat accordingly. When most professionals think about a disc injury, do you know what type of special imaging immediately comes to mind? MRI. Magnetic resonance imaging, the gold standard for detecting and quantifying the extent of this type of ligament injury. So here's the problem. There are 10 ligaments between every two adjoining vertebrae in most parts of the spine. That's right, 10. In the big picture, it's reported that there are over 220 specialized ligaments throughout the entire spine. Of these 220 ligaments, 23 make up the discs, meaning that the discs only represent less than 10% of the ligaments in the human spine. So if a doctor orders an MRI to assess the extent of a spinal injury and it comes back normal, now what? Clean bill of health? Everything must be fine? Just a soft tissue injury? No. If the doctor draws that conclusion, they just did you a huge disservice if they didn't further conduct the proper testing to assess the other ligaments in that area of the spine. That's right, spinal ligament injuries are the #1 cause for pain and disability in the world today, and most doctors routinely fail to properly diagnose them or treat them accordingly. How would you feel if you found out that there was a simple and accurate test that uses well-established American Medical Association guidelines that, when correlated back to examination findings, would clearly direct the appropriate care to the specific parts of the body needed? The good news is we are experts in performing this test and in our clinical treatment of these types of injuries, so we have all of this covered for you and your loved ones. Okay, so how do we find these hidden spinal ligament injuries? They are discovered on something called stress radiography and a comprehensive examination that relates back to these findings. Specific measurements are performed on these x-rays to determine if there is something called excessive motion present. This means that a bone in the spine is either bending too far or shifts too far when the spine is moving. The really powerful thing about this test is that when the findings are considered relevant, they are backed by well-established guidelines that have been published by the American Medical Association. These are called AOMSI, or alteration of motion segment integrity. The injured person either does or doesn't have a relevant finding. It is objective and it guides our treatment to exactly where it's needed for the best recovery results. Not only do we interpret this X-ray analysis ourselves, we also routinely send these images out to a third party in order to confirm our findings. That means that we send these excessive motion X-ray studies out to board-certified medical radiologists for them to further interpret and analyze these images to obtain an accurate diagnosis. Earlier I mentioned this idea of it's only a soft tissue injury. This phrase is used commonly by the doctor who fails to specifically diagnose the injury or the insurance company that wants to argue that you couldn't possibly be injured so they can save money and move on to the next person. This results in the injury never being properly diagnosed, then you receiving non-specific care that will inevitably fail to prevent this acute injury from turning into a chronic lifelong condition. The body is comprised of both hard and soft tissues. The hard tissues are bones and everything else is considered a soft tissue. So things like disc, other spinal ligaments, brain, spinal cord, very crucial structures that when damaged make up the absolute worst kind of injury that you can have. In the next video, I will briefly summarize why our unique clinical approach attracts patients to drive from hours away and instills trust in our other local medical providers to confidently refer their patients to get access to this comprehensive level of care.
Video presentation by Meridian, Idaho Car Accident Chiropractic. We dedicate our service to Meridian, Idaho, auto accident victims who have been in a car collision and have experienced personal injury. Idaho law allows motor vehicle victims to pursue personal injury claims legally, and if you are not at fault, your chiropractic healthcare is covered 100%. The doctors of chiropractic at Meridian Car Accident Chiropractic in Meridian, Idaho, are specially trained to diagnose and treat hidden injuries following a car collision. If you or a loved one has been injured in any type of motor vehicle crash, we are here to help you get your life back on track. We provide clinical, diagnostic, and treatment excellence. We accept car crash victims, whiplash injury victims, commercial truck accidents, and motorcycle accident victims. There is no fee for you, your loved ones, and your friends to seek chiropractic care at Meridian, Idaho Car Accident Chiropractic. Call now 208-581-4353 and let's get you back on your feet.